Hi, my name is Scott Pickering from Brandon Medical, and I'm here to discuss the principles of design for ergonomic pendant solutions for minimally invasive surgery and intensive care units. Ceiling mounted pendants, or booms as they are sometimes known, were fundamentally designed to bring medical gas, electrical and data services closer to the patient, and in doing so eliminate the need for trailing cables that traditionally been routed from the walls of the room to the patient. In doing so, the operating rooms and critical care bed spaces became infinitely safer and more ergonomic for the staff to use. In more recent times, the move has been how to use these functional and increasingly essential pieces of hospital infrastructure in these specialist environments to not only reduce the time spent changing a theatre around between cases, but also to aid and speed up the patient's recovery process and so reduce the time spent in the ICU environment. Bearing in mind these two critical environments serve two totally different purposes, the flexibility of the ceiling mounted pendant has proven key in achieving this. The design engineers have had their work cut out to fulfill both of the design briefs using essentially the same piece of equipment. Fortunately, some of the pendants in the global marketplace have managed this without changing their fundamental design and have used the natural flexibility in their design to enhance both environments. The use of ceiling mounted pendants in ICU environments is commonplace, allowing for better and easier patient care by enabling staff to nurse the patient from multiple and optimum positions. But how could the pendants actually help and speed up recovery times, especially now that patients were spending more time conscious on the unit than in the past due to advances in ITU procedures and nursing techniques? A leading clinical intensivist spent a number of years investigating the challenges in the ICU of post-operative delirium and just how to improve a patient's stay, and the pendant became one of the focal points in just how to do this. One of the major reasons for the development of anxiety and agitation in critically ill patients is the ICU environment itself, and 80% of critical care patients experience delirium, post-traumatic stress disorder, anxiety or depression. It is recognised that there are a wide variety of environmental factors that affect patients in ICU. They all interact with each other and can have significant effects on the health, well-being and outcome of critically ill patients. Many patients spend weeks or even months in critical care while they recover from life-threatening conditions. A significant number of patients suffer from delirium as they drift in and out of consciousness, which can be frightening and delay recovery. To begin with, we'll talk about pendant arms and their electromagnetic brakes. It's known that natural daylight, as opposed to ambient LED light, aids the healing process. To be able to turn a patient around to look out of the window as opposed to inside the ICU is better. The pendant arms enable the staff to turn the bed spaces around and reposition the pendants so that the patient can remain intensively treated. With happy staff, patients recover quicker. When patients are less intensively treated, to be able to move the pendant easily away from the bed, perhaps towards the side of the room, means the room becomes less threatening and more homely. Patients' family are likely to feel better if the nursing staff are happier or the pendant is less obtrusive, or painted in a more natural colour as opposed to a clinical white. It's easier for the patient and staff to interact if the pendants are easy to move or less obtrusive. The use of colour coding the brakes to make life easier for the staff is commonplace, but to have them light up in different colours is relatively unique and a great help to the staff, especially at night. Pendant lighting is another area that can potentially help the patients recover. Being able to gently light up the critical floor areas for nursing, namely around the head of the bed, is a great help to the nursing staff. To be able to complement this with ambient uplighting as well ensures a better working environment at certain times of the day or night and avoids the use of direct general lighting which could disturb other patients. The pendant console or the column design. With patients often feeling threatened whilst in the ICU if suffering from post-operative delirium, to ensure where possible a normal environment can be crucial. With all the clinical equipment that can be used on a critically ill patient, it can be very difficult to keep the pendants compact and unobtrusive. by using a multifunction rack that is independent of the service console itself, allows the pendant console to be kept to a minimum whilst allowing equipment accessories to be installed along the full length of the rack without any restrictions due to the console itself. The added advantages to the patient and relatives is obvious. However, the creation of space in an often cluttered environment to create normality can be another contributory factor in the speed patients can recover. Another area where assisting patient recovery times is the use of patient entertainment terminals. To assist with minimizing the stress levels of the patients and relatives, increasing numbers of ICUs are being designed to look more calming and less clinical. The patient's environment can be improved with the use of all-in-one computers suspended on flexible pendant arms, allowing a patient to listen to their favorite music or see some familiar pictures or even FaceTime their children at night. A few little everyday things like this can have a massive impact on a patient's well-being. At the same time, the clinical staff can use the same monitors for their everyday reporting, made possible by the flexible nature of the pendant designs. Early patient mobilization is also recognized as a way of speeding up the recovery process. Patients in ICU spend most of their day in bed. Physical inactivity may result in post-intensive care syndrome. Hoists can now be used with pendants to enable patients to become mobile and weight-bearing sooner to avoid muscle decline. The pendants make this possible, giving the best protection against falling. The hoists have the added advantage of making moving patients safer for the nursing staff. Pendant flexibility and safety. The ability to quickly move the pendants in an emergency is of paramount importance, giving the staff free access to the patient. Coupled with the pendant's ability for integrated cable management, a safe working environment can only be good for both the patients and staff. Ergonomically designing the bed space for safe patient care is vital to improving the patient experience. Ensuring medical sockets are available at the foot of the bed continues the theme of a safer working environment. The temporary connection of ECMO or dialysis machines at the foot of the bed become much simpler with power rails that can be designed into the pendants. The use of tandem pendant solutions in the ICU enables hospitals during emergencies like the current COVID-19 pandemic to double up on the patients being looked after on the unit. Conversely, there may be some new clinical thinking that is looking at designing general ward areas that can be easily turned into HDU or ICU, when required by using a single side of the tandem pendant for general ward use, then if required, using both of the pendant consoles if the need is more intensive. Many of these same pendant design principles are being transferred into the theatre arena, where traditionally pendants were just seen as a way of providing gas and electrics to the trolley-mounted equipment. Theatres tend to be very busy areas, much like an ICU environment. However, if the flexibility of the ceiling-mounted pendants can be harnessed by the clinical staff, much of the equipment that tends to be on the floor can be transferred to the pendants. Pendant flexibility is the key in operating theatres to enable the theatre to be used for more than one type of surgery. Dedicated theatres are becoming a thing of the past as technology inside the OR increases. More and more operations, and by definition more operating rooms, are being used for minimally invasive surgery, and with time constraints in ORs becoming increasingly pressured, being able to change the orientation of the table or to move equipment to different areas of the theatre for a different surgeon have become paramount. The choice of pendants with electromagnetic brakes makes life much easier for the clinical staff, as they do not have to worry about running trolleys over trailing power cables. In the past, it was probably easier to leave the equipment where it was, rather than in the optimal position for the surgeons. This could affect the time the operations took and so increase the pressure on the theatre time. With an ever-increasing array of medical equipment being used in surgery, the importance of being able to mount a lot of equipment to a pendant, similar to an ICU, is key. Pendants that have an easy-to-use accessory mounting solution, as well as a high load capacity, may be preferred. Pendants that can mount multiple monitors, as well as multiple laparoscopic devices and printers, will be a useful addition to any project. If at the same time the size of the pendant services consoles can be kept to a minimum, This can only help in the efficiency of the OR as they become increasingly crowded with equipment, instrument trolleys and staff. The use of multiple monitors in the OR is also becoming more prominent as the pendant and operating light systems are being increasingly designed to mount these monitors to enable the theatre staff to be able to view the screens from the optimum positions rather than where the trolleys themselves could be moved to, which would become difficult with the other trolleys and staff taking up so much room in the OR. In conclusion, the use of multi-armed ceiling-mounted pendant solutions has proven a key contributory factor in speeding up the recovery of ICU patients. This in turn frees up ICU bed spaces to allow more critical elective surgery to be planned, which will assist in reducing waiting times for surgery. These same pendants with their ergonomic features can speed up the throughput of patients by efficiently being able to reconfigure the theatre for different types of surgery. It's clear to see that the use of these essential pieces of hospital infrastructure should be considered as an important part of designing a new ICU or theatre environment.